Hi, everyone. Welcome to the first episode of Calm&FOCUSed. This podcast series will cover different aspects of mental wellness and emotional health. Anything from symptoms to etiology to neurobiology to treatments. Now, if you paid any attention at all to the news, it may seem obvious that mental wellness is a very, very timely topic. In particular, this episode is about understanding our emotions during this COVID-19 pandemic. I'm Dr. Kai-Ping Wang, Chief Medical Officer of High Focus Centers. I'm a board-certified adult, adolescent, and child psychiatrist. It's my pleasure to introduce our first guest, Kelly McLaughlin. She's the executive director of our Branchburg location and has been with High Focus since 2012. She served as adolescent psychiatric clinician, adult service coordinator, and she's been in a number of settings: outpatient, residential, inpatient, intensive in-home therapy, and academic counseling. So Kelly has a wealth of experience and expertise with which to share with us. So welcome, Kelly. Thanks for joining us today.
Thank you for having me.
We're recording this in July 2020, several months into the COVID-19 pandemic. Now, this has been a trying time for the entire world. And maybe I'm not doing so well myself either. So Kelly, is it just me?
No, I think you're correct in what you're saying. There's been a lot of current research and support that people are really struggling since the onset of the pandemic with their mental health symptoms. Polls have shown that 56% of adults report that worry or stress related to the pandemic has affected their mental health and well-being. These symptoms include trouble sleeping, eating, drinking alcohol more frequently, GI issues, headaches, shorter tempers, and agitation. Those directly impacted by the pandemic with a loss of a job, employment, loss of loved ones, or onset of illness. People working on the front lines report an increase of these symptoms by 65% of the adults who were polled. Reports also indicate that the pandemic could lead to 75,000 additional deaths related to alcohol and drug misuse and suicide due to the stressors related to the pandemic. Historical evidence has shown correlation between illnesses related traumas and unemployment. With unemployment increases, there's a correlation between those and then thus resulting in suicide. So these, looking at historical evidence of other situations that have been relatively similar, have shown that when there's a lot of job loss because of the loss of identity and also unemployment, those rates increasing also increases in suicide and alcohol use. So it's too soon to see the full impact of this, but over time in the coming years, there could be a heavier impact on the mental health community. Social supports are shown to be a buffer to a lot of these effects of disasters and pandemics and crises, but due to shelters in place and isolation, finding supports right now is more challenging. Recent call center statistics have also shown that there's been a major increase in percentage of call volume as opposed to last year, so a 33.8% increase. On the disaster distress helpline, the National Suicide Prevention Hotline also reported a spike in calls over the last several months, and they report that the calls stemming from anxiety and stress and fear related to the current pandemic and COVID-19. In addition, the social distancing parameters put in place, people are reporting difficulty knowing where to seek help due to wanting to avoid community locations like group settings, inpatients or residentials, ERs, and things like that due to fear of exposure to the virus. So a lot of once tangible access to healthcare and mental health care is now limited. Social support is shown to buffer the effects of, disasters and pandemics and crisis. And, with all of the isolation and a lot of things have moved to virtual and telehealth, there's just not as much support for people. So there's just a lot of increase in these symptoms. And with a lack of support, it's combining with a general spike in the mental health symptoms that I just reported on.
Wow. So it kind of almost meets that cliche of a perfect storm situations.
Yes.
Things
it does.
Now, you mentioned terms like fear, stress, anxiety when you talked about the impact of the pandemic. Can you tell me a little bit more about the difference between those terms?
Sure. So stress is a normal physiological response to an abnormal situation. It enables our body to adapt to a multiplicity of positive and negative events that we experience, like a birth, marriage, loss of employment, etc. Fear is a reaction to a specific observable danger that's happening in the moment. Fear is typically attached to a specific thing, event, or circumstance. Anxiety is the most commonly diagnosed mental health condition in the world. There are several different varieties of anxiety, but signs and symptoms are typically universal. It's safe to say that most people have experienced some sort of wave of anxiety in their life. Often occurs when you do something you're not comfortable with, that's a natural form of anxiety. When anxiety becomes to happen more persistently and begins to impact you on a daily basis and you're functioning altogether, that's an indicator of an increase in anxiety that might require more attention, support, or medication management. These symptoms include fixation on the future, restlessness, difficulty concentrating, nausea, vomiting, GI-related symptoms, persistent fear of death or dying, muscle tension, body aches, sweating, shortness of breath, trouble breathing, related to like panic or anxiety attacks, insomnia, trouble sleeping, staying asleep, or waking up in the middle of the night, and irrational fears and cognitive distortions. Difference between anxiety and fear is they're closely related. They both contain the idea of danger, the possibility of injury, or something bad happening. Anxiety is typically a more future-oriented thought process and comes without direct evidence to support thoughts what could potentially happen in the future, where fear is more in the moment based, and there's usually an actual perceived danger that you're witnessing. Again, common symptoms being reported that people are experiencing now are related to anxiety. So a lot of virus-related worries and insecurities, feelings of being overwhelmed by events, negative visions of things or daily events, feeling disconnected or discouraged, headaches, sleep problems, lower appetites, lower energy or fatigue, difficulty concentrating, more irritability and aggression, crying, withdrawal, and difficulty in making like life choices right now because of fear of like kind of like the future. Like, what is the future going to bring right now? What's happening? Can I plan for things? How do I keep my family safe and things like that? And in addition to that, increase of alcohol and drug use can also be impacting these symptoms during this time.
Wow. Okay. So a lot of physical, emotional symptoms, feelings that can come up in response to all this stress and fear and anxiety. Mm-hmm. Are there certain things you would suggest that people can do to try to manage those symptoms on their own?
Yes, there's a lot of things that people could probably do on their own at home. And there's also a variety of like interventions that can be used from the community, even though we're a little more removed right now. Starting at home and kind of taking care of yourself on your own would start with some self-care strategies. They're good for your mental and physical health, and just kind of reorganizing and taking charge of your life to kind of gain control over like what the anxiety and fear are playing into. So one thing to do, a self-care strategy, was be getting enough sleep, going to bed at the same time every day, waking up at the same time every day, sticking to a schedule. Even if you're just staying home and not doing things, a schedule is important to kind of keep your body and your mind focused. Having an agenda and getting enough sleep is important to anyone's health. Participate in regularly physical activities. So getting some kind of exercise or activity, and whether it's hiking, walking, leaving the home in an appropriate way. Obviously, gyms aren't open, but just doing something physical. So that's a clear correlation between addressing anxiety and depression, even outside of pandemic, would be regular exercise. Eating healthy, choosing a balanced diet. Obviously, a lot of research supports healthy eating impacting mental health in a positive way. So avoiding alcohol and drugs, limiting screen time. So turning off electronics for some time during the day. We're spending a lot of time on electronics now. So a lot of things are done virtually, and that could get really consuming. And that might have been something you didn't do as much when in this kind of where we transition to a lot of virtual. So taking the time out to make sure you're shutting things off for certain periods of time in the day so you're getting time for yourself, not just constantly looking in front of a screen and getting outside. And again, in relation to that same thing, relax and recharge, setting time aside for yourself to relax, even if it's just a few minutes of quiet time, unplugging, getting outside, doing something like a yoga or meditation, reading a book, listening to music, whatever helps you relax, and kind of making sure you're practicing those things a couple of days a week. So those are all things that people can just do on their own when they're experiencing the regular, normal stress of what's occurring. Another thing is to take care of your mind. So reduce the stressful triggers that could be impacting your anxiety during this time. So like I had said, getting enough sleep, but making sure you're maintaining a regular schedule. So I think a lot of people are struggling with a huge shift in their schedules because they're not commuting to work or not going into an office or just overall, unemployment or things like that. So making a schedule and sticking to it, having some responsibilities each day, waking up at the same time and kind of doing something that kind of gives you the purpose to like not just lay around in bed. Limiting exposure to news media. So there's a lot on the news and it can be very overwhelming on many social media platforms as well. Making sure you're limiting that exposure, not to stay uninformed, but making sure you're getting your information from reliable resources and also just doing it in doses, not maybe every single day, all consuming, just leaving the news on and just kind of doing it in doses that are appropriate for you, for what your needs are, to just stay informed and just to stay busy. So not to just sit at home and watch TV and watch the news all day or stay in front of a computer. Like I said, making a schedule, giving yourself structure, incorporating the exercise and kind of finding some activities to stay busy. Another big component would be to connect with others. So building a support and strengthening relationships. So making connections, a little difficult now with the distance in place, but finding ways to connect, even if it is virtually, using, FaceTime or different Zoom apps or things like that, doing something for others. So whether it's creating something and donating, there's a lot of needs for first responders or frontline workers or things like that. Helping the elderly who maybe more are in need of more, or taking up a new hobby, things like that, to kind of get yourself added more structure, but also doing for others kind of fuels feelings of positivity. And that kind of will be helping with eliminating maybe some depression or anxiety that people could be feeling right now. And then supporting others. So supporting a family member or a friend in need, not isolating and reaching out to others, even if, there's a distance between you, but just kind of staying connected.
Well, those are great suggestions. I like pretty much all of them, except maybe, stopping the screen time and going outside.
Yeah.
But no, I totally don't have a problem with video games. So,
a lot of screen time right now.
So now mindfulness. Mindfulness, we know, is a therapeutic technique that helps us manage stress and anxiety. Can you describe, explain what exactly mindfulness is and how we can use it?
Yeah, that's something we use a lot in our practice here at the Partial and IOP and High Focus Centers. It's kind of one of our staple curriculum components pre-pandemic, just in general. So mindfulness is taking time to focus on the present, being intentional and thoughtful about where you are and how you're feeling, trying to set in your thoughts and to be in the moment. So really it's to do one thing at a time, to focus on one thing at a time, not to multitask, and to really just what you're doing is to be there and experiencing that. And we use that to combat the anxiety, because anxiety, again, like I said, is a fear of projection of the future. Like, what is going to happen? What if this happens without? And then while we're thinking of those things, we're wasting the time of what am I experiencing right now in the moment? So the mindfulness can bring us back to that. And where are we now? We're safe. We're okay. Things may not be ideal, but the reality is I don't know what's going to happen in the future, and I need to enjoy the moment now. Examples of mindfulness that we try to teach: different guided muscle relaxations, different types of breathing exercises. So like belly breathing, square breathing, eating mindful meals. So that would be something where you're totally just focused on the meal. There's no electronics, no outside or external stimuli, just kind of really focusing on what you're eating, how does it taste, and enjoying that entire moment. Not multitasking. So you're not watching TV, reading emails, and texting someone. You're doing the one thing. Addition is a meditation. So we use different apps to do some of the meditation. There's a lot of different apps out there now where people could do like a 5 or 10 minute meditation every morning. And that usually helps with bringing more clarity to the day, or like an ease to the anxiety and things like that. Different grounding techniques. So grounding techniques are different things you can use to refocus yourself. Some people will just, let me look at all the colors in the room and label them. Let me list all the states out loud. There's a 5 senses grounding, which is kind of doing 5 things you see, 4 things you hear, 3 things you taste, 2 things you smell, and kind of going down the 5 senses and kind of bring you outside your thoughts that could be spiraling. Coloring or art is another good mindfulness exercise, listening to different music and things like that. So there's a lot of different apps out there too that can, you can use and research to kind of find different techniques that could work for you. It's important to make time to practice the mindfulness because it's a skill that needs to be learned over time. It's easy to try it and maybe it doesn't work initially or something like that. So it's something you should practice every single day and find what works for you as far as the mindfulness activities. Right now, there's not a lot of personal time. A lot of people are home with their whole families, not leaving to go to work. Kids aren't leaving to go to school and things like that. So making sure you have an intention to add that to the schedule of your day to make sure you're taking the time out to do it for yourself. And then even having the opportunity to do some mindfulness family activities. So I think it's important to incorporate it in the family because if one person's experiencing the anxiety, I'm sure the rest of the family members could be as well. And kind of in this trying time. So practicing mindfulness as a family would be like designating time to practice things like the mindful eating. So the mindful eating as a family, focusing on each other, asking questions to each family member and having them answer and that be the topic, not a distraction where someone's on their phone or they're, disconnected. So trying to bring it back to that. Going for a hike as a family, doing different art projects together, things like that that'll incorporate no external stimuli and kind of just focusing on each other and the moment you're in.
Now, Kelly, say I try some of these things, say that, I'm actually spending time with a family. We actually go outside and get fresh air and it's not really working. What are some signs that I kind of need more support? Like when do these things become more than just mild symptoms?
Right. Yeah. So I think right now there's a normal, a heightened level of anxiety or stress right now would be the norm in these times. Many people have mental health concerns such as symptoms of anxiety and depression, and they may be a little exacerbated because of what's going on right now. If these feelings continue to change over time, and despite your best efforts, like all the things I kind of named, if you're doing all these other things at home and it's still not working and you're still having, you're feeling like helpless, sad, angry, irritable, or hopeless, more anxious or afraid than normal, trouble concentrating and not be able to complete tasks, you're trying the mindfulness and you just can't really concentrate and complete it, struggle with, day-to-day chores, routines, not being able to complete them. And like I said, if you've implemented all the previous coping skills and it's still not working, and if there's like an increase in what you notice as far as like alcohol consumption or behavior that you wouldn't normally engage in, or if you're having any suicidal thoughts or ideation or like those feelings of hopelessness, helplessness, if those are really increased, then it would be a time to seek a higher level of care or seek some help for yourself.
Mm-hmm. So where would you recommend that I start looking if I do need this extra help, this extra mental health care support? Where can I try to find it?
I think, it depends on every person's particular situation, what treatment they've had before, what doctors they have in their network and things like that. So reaching out to like a loved one, so like a family member or friend could be a nice place to start too. Getting support, talking to them about your feelings and what's going on, and then maybe making a plan with them of like what you think is needed. If you're employed, most employers have an EAP, which is an employee assistance program, which can typically give you initial support or help guide you to find what is needed for your exact symptoms. Calling your primary care provider. So a lot of PCPs will do these screenings as well and can give you either a recommendation or either treat what you're experiencing. Additionally, you could always call your insurance company for mental health practitioners. And if you know you want a therapist or if you know you want a psychiatrist, can help you get to a mental health practice that's in your network and in your area. In addition to contacting organizations like the National Alliance of Mental Health, which is NAMI, or the Substance Abuse and Mental Health Services Administration, which is SAMHSA. So every county has their own affiliation with those alliances, and they can also provide supportive services. So a lot of times it might be virtual right now, but have support groups you could attend or could point you in the direction of the services referrals you might need. If you are feeling suicidal or thinking of hurting yourself, it's important to seek help immediately. So contacting your primary care provider or your already existing mental health care professional. You can also call the suicide hotline. In the United States, it's a National Suicide Prevention Lifeline, which is 1-800-273-TALK, or use its web chat at suicidepreventionlifeline.org/chat. In addition to, you could go to your local emergency room or call 911 and ask for assistance in that way. Currently, most providers are offering the telehealth therapy to assist people during this time. So it obviously depends on the area you live in and what kind of restrictions are going on. But individual therapists and psychiatrists and intensive programs have the ability to provide effective virtual treatment to all patients and to follow the current social distancing protocols. And insurance companies are authorizing virtual treatment to be covered as well during this time for all plans.
Okay, great. So you mentioned outpatient therapy where you see an individual therapist or psychiatrist, but then you also talk about these more intensive programs. So these more intensive programs, I was wondering if you could describe what are these higher levels of care, and those that are providing telepsychiatry and if they are effective.
Yeah, sure. So, there's the level of care, which would be like an outpatient therapist or psychiatrist that you would go to either once a week and maybe a psychiatrist every couple months. Mm-hmm. More intense level of care would be like inpatient. There's an in-between level of care, which is partial hospitalization or intensive outpatient. Basically, you're assessed for the need, like what an assessment is given, and what the need is would be dependent on which program you go to. So the partial is 5 days a week, typically anywhere from 3 to 4 weeks. IOP is 3 times a week and anywhere from 6 to 10 weeks, depending on what's needed. And these are group-based intervention. So you attend a group with multiple other people, and also you have a psychiatrist or APN that would meet with you for medication management, and also have a therapist that would meet with you for individual therapy weekly. Currently, I think most programs are running these platforms virtually due to not being able to be grouped together for the safety of everyone. So it's been really successful. I know at High Focus Centers, we've been doing it since March, and it's been very successful. We've given out surveys and things like that, and people are really responding well to the virtual. We actually have probably able to access more patients than we normally would, because sometimes people have the anxiety of coming in or being in a group setting, and the virtual platform allows it to do the comfort of their home, which it might be a little more comforting to others. So surveys have been given, like I said, an overall positive response of 97% of the participants and families feel satisfied with enjoying the telehealth care services. We also offer services to families. So we offer a family night group once a week, which has been a really good response to the families in the community who need support as well. We're also able to give, any referrals to outpatient therapists or psychiatrists for when they return or complete our programs. There's one other benefit to the group therapy is like people are feeling less connected right now to one another. So I think that even though it's virtual, the group platform allows people to have the connection to others and to experience engaging with other people who feel the same way as them to kind of reinforce and support what they're going through. So it's a nice, way not to be isolated during this difficult time.
Right. Well, thank you so much, Kelly. I think this is a lot of great information. I think it's good for all of us to know that there are ways that we need to take care of ourselves. And if we do need professional help, it's out there. Yes. So whether you seek help, with your primary care physician, outpatient therapist, psychiatrist, or you need an organization like us, HFC, it's great to hear that those things are available.
Yes, it is. And we've been having a really good response to the virtual therapy. So if you are in need or feel like things are getting a little out of hand, it'd be a good time to maybe just reach out and get those things started for yourself.
Great. Thank you. And thank you for listening to this first episode. Everyone, please stay safe. Thanks. Bye-bye.